Okay, great. Thank you for joining us. So good afternoon, everyone, and welcome. My name's Jed Griffiths. I'm the chair of the Institute of Physics Business Innovation and Growth Group, or BIG for short. That's one of the special interest groups at the IOP. And it's a pleasure to open today's session, which explores how startups can transform careers, companies, and actually the broader innovation landscape in the UK. And we're here because the UK's deep tech startup ecosystem, particularly those rooted in physics, holds an immense and untapped potential. Now, these ventures are not only engines of innovation, but they are critical levers for economic growth. And physics-based sectors already contribute at somewhere in the tune of around £150 billion to the UK economy, employing just under 10% of the workforce. And yet, in the IOP's recent report on venture capital in physics and deep tech, as this report highlights, we're falling short, really, of unlocking that full investment potential of these businesses. In fact, the report estimates that if physics deep tech startups were attracting funding on par with other science sectors, it could unlock an additional £4.5 billion in investment over the next 5 years, right? But to get there, we need to bridge the gap between scientists and investors, rethink how we support early age ventures, and create clearer, faster pathways to commercialization. And that's where the big group comes in. We were established to champion the business-minded physicists, physics-based businesses, physicists working within business, and support the growth of physics-powered enterprises. And we do that through events such as this one, expert advice, networking. So do reach out to us and colleagues if you're in that space and you'd like some support. And we're covering everything from spin-outs, SMEs to scale-ups and large enterprises. So we know that this is an aspiration of other institutes too. And so today, in partnership with the IET, this webinar is part of that mission to spotlight the opportunities, help reduce friction, and inspire more people, especially the ambitious and the curious, to see startups not just as a career option, but as a career accelerator. So we're thrilled today to be joined by two speakers who can help sort of exemplify this journey and give you that advice. Dr. Mark Szyborylski, a long-standing member of the Business Innovation Growth Group and guru on venture capital seed vesting and a friend of mine, and Dr. Jeremy Holland, Chief Executive of Cranio. And they'll both share their insights and experiences, including the story of Cranio, which is a recent IOP Innovation Award-winning startup and blazing a trail in their sector. Thank you both for joining us. I will hand over to you, Mark.
Thank you. Greetings, everybody. Thank you. Right, let's see if we can get started. So my name is Mark Szyborylski. I'd like to welcome you to our briefing webinar on startups and how to best make use of them, as they are an undervalued resource. As Jed was saying, no economy needing growth can afford to ignore or not make the most of startups. They are a catalyst for innovation and growth. Now, this event is a joint venture between the Institute of Physics and the Institution of Engineering and Technology, and it covers territory which is of great importance to both institutions. So my thanks to the IOP for hosting this event. My colleague on this webinar is Dr. Jeremy Holland, the CEO of Cranio, who will paint a picture of life within what I think you will agree is an impressive startup. And in this webinar, I represent the Innovation Management Technical Network at the IET and the Business Innovation and Growth Group at the IOP. And this webinar does not presume to represent official policy of either institution and is based on our experience in this sector. So just as a personal introduction, let's stop sharing. That I am a high mileage technology venture capitalist, an engineer and a physicist. And this webinar is based on my long-term VC and startup history, combined with my work on linking universities to companies and vice versa. Just a short introduction from Jeremy.
Yeah, hi, I'm Jeremy Holland. I'm Chief Executive of Cranio. We enable the quick, simple, cost-effective, and importantly, non-invasive measurement of intracranial pressure which is a key physiological vital sign indicating the severity of traumatic brain injury. It's a bit of a word salad, and I'll explain what that all means in my part of the talk. My background is in technology. I studied physics at university, and I've been in technology ever since, in the last 25 years in leadership positions in early stage companies. I started as chief executive of Cranio when it spun out in 2022. And we were awarded, as Mark and Jed said, the Institute of Physics Lee Lucas Award for the innovative use of physics in medtech companies in 2024. I'll leave it there because I'll talk a little bit about my background and journey a bit more in the presentation. Back to you, Mark.
Thank you. Now, my real role is to Jeremy's warm-up act with a briefing on startups as a career option, and also why we should be looking at startups as from the point of view of companies. So that's what we're going to run through first. It's old school, so bear with me. Our starting point here is that startups are already massive value for money, but we have difficulties in getting them all across the line and making good use of them downstream, and this webinar tries to address that. Startups can become the companies of tomorrow, but actually it's just as important that they should be the accelerator of companies we already have. And therefore it's to be encouraged that existing companies contact and look at startups or something at the moment they are not doing. Now, in particular, startups need to be noticed early. And since the UK offers bargain basement R&D because of its lean funding structure, there are advantages, but there are also gaps in funding upstream, and we're going to have to talk about that. Now, startups are actually growing in number, and we need to capture the benefits. And where universities link to startups, these are always often important, and technology startups will always find universities useful and sometimes even essential. The innovation centres associated with some universities have added momentum to startup growth by providing support in early stages. However, many would-be startups still do not make it for resource reasons, not a lack of viability. And our case study today is based on the commercialization of groundbreaking Meditech University research at City University, which has no innovation centre, and with some significant encouragement from the IOP. Now, because I wanted to make sure that some of these slides are stored with you as handouts, I suggest that the red-starred slides that to follow contain briefing content which is intended to be saved and captured. And here is how we can do this. Now, you're probably all experts, so you know all this, but if you want to capture the slide, it's very simple with Microsoft, its print screen and function. And of course, if you're obviously if you have a Mac and are therefore digital aristocracy, it's 3 buttons and then it's deposited on your desktop. So bear that in mind, try it on this slide, see how we go. Now, this is going to be an important slide as well. So we almost thought of calling this event 14 ways in which startups can be useful to you. But let's look at 14 ways that they can be useful to you. And this comes in 3 parts. First, at career level, which is obvious. A great way of obtaining early shares, by the way, don't ignore that. But also invaluable learning experience, and certainly with team skills as well as finance. And note the later stages of startups when the founder to board transition occurs, and that's a good place to join. So given that technology businesses are usually result from that type of startup, if you're a student or a graduate or a PhD, do consider this as being an option. The actually bigger block of attention here is whether the company, what would make the company address the opportunities that companies which are currently being missed. And I really want to stress this area. If I mention R&D, that's because if a startup has an R&D skill that your company would covet, just approach it. In fact, companies welcome that sort of thing because possible R&D in such companies funded means that they haven't got to chase venture capital quite so hard. It often works. And then if a company sees a startup with a potential product source that would be appropriate to territory that it already has, there's a conversation to be had. And in fact, supply chain issues arise here. We're in a world where supply chain companies produce that which larger companies actually put into the marketplace. And startups should fit into that structure too. And the PE-funded companies, PE, private equity, they're generally somewhat overgeared and not able to invest in innovation. On the other hand, they have marketing budgets, and the marketing budgets are more appropriate to startups. So there's a link there which we are exploring and may be really quite important. And the rest are fairly obvious, but also being able to see what the future is in terms of who's preparing what, that's a very good education. And the third layer of that, and this is the time to capture this slide, is that there are potential merger activities between startups which can actually add a lot of value, and no one's doing them. And consulting and NED's help for the companies to bridge to the startups can easily be achieved. So that combination of events is something that we would consider, or added value, consider would be rather important. So that's what we can do with startups. But the next question we should answer is, where do we go to find startups? And I think you could always start with the Golden Triangle, of course, Oxford, Cambridge, and London. But I would recommend Set Squared for another reason. 6 leading research-led universities, Bristol, Bath, Exeter, Southampton, Surrey, and Cardiff. They have a well-designed and evolved business incubation service and readiness for investment program. And because they've been running for ages, they've actually supported a huge number of entrepreneurs, and a 5 billion income investment into these is what they've achieved, and the impact is 15 billion. Now, that is spectacular, but it hides two weaknesses. One is that well, this is only a fraction of what startups can do and what impact they have, because obviously the process of creating startups can be improved, but also there is a funding aspect to it. And incidentally, Set Squared is now well integrated under the leadership of Marty Reed, whose name I leave there. And again, keep this slide because you'll be able to see the way that Set Squared promotes and creates a forum for its startups. I mean, Oxford and Cambridge spend about 600 million a year in R&D, and the same as Set Squared, but the Set Squared startups only raise 1/5 of the funding of Oxbridge startups. So work has to be done, and therefore activist VC is required, activist venture capital, and corporate venturing to fill the gap. So that's something that we have to consider. And a useful comment from Cambridge Innovation Capital, who Rupert Baines is quite well known, indicates that really the expectation now of academic research in many cases is that something will be commercializable from what is being done. And in my view, this is also mirrored in other universities and university groups, although technology push needs to be combined with market pull, and that has to happen really outside the university. Now, next area is, there is an active UK startups community and infrastructure for startups, and it's surprisingly wide-ranging. Let's start with the Startup Jobs, a recruiting platform for UK startups, and all startups are inherently incomplete by definition, and as they progress there is definite room for a jobs platform. So it's amazing that that exists, but it does. Secondly, Startups 100 is a database and an invaluable resource, and it has a list of all the 2025 startups. And I mention here also Second City Ventures, which is a support for a university which does not have an innovation centre to create part of what is in effect a virtual innovation centre in London. And this fits very well with the IOP accelerator, which is exactly in the same space, and contacts there. Also, being an accelerator for startups at its headquarters in King's Cross, and this targets early phases of physics-related projects turning into companies and adding to the startup community in London. This sits beside several London-based universities without incubation facilities and offers an incubation space with a number of startups already making use of this facility. So I imagine that the IOP's Business Innovation and Growth Group may be accessible to such companies. And finally, on this sector, there's a Startups magazine. That's briefing material and an oversight of the sector. So before the toe is dipped in the water, always worth a look at. Right, so let's move on now to where projects actually start and go. I mean, the ideas all take shape as the ideas turn into projects, and they take shape as they tackle challenges. Individuals turn into partnerships, and on the way to succeed, they must become market-driven teams. And solo inventors are rare, and innovation centres and university surroundings are the main sources, although there are spin-offs as well. Business schools can create entrepreneurs, but somehow rarely do. Their alumni can be more important as angel investors, and there are several such groups that are worth looking at. Regional startups are important, and their quality is often missed, and they have difficulty getting funded, but they're just as important. And note the company spin-out possibility. Quite often projects get shut down within a company, which is very wasteful, and mechanisms of sharing those or spinning those out, or intrapreneurs in companies going the other way and looking at the startup model are important. So rarely happens, but it should. And that's the route. Obviously, project turns to team to startup, seed funding, Series A first round, and maybe Series B and so on, and then into what is hopefully real territory and a safe operating area for the company. Now, if you are considering working in a startup, there are pluses, there are minuses. This is a recent survey, and this is what the pluses and minuses turned out to be. But on this list, everybody will consider different pluses and minuses as important. So I won't rank them. The overarching issues must be the belief that the startup can finally succeed and thrive rather than just flame out. By the way, not all failures need to remain failures. They can just be incomplete. And park and restart is a new approach to these things, where the folder may actually contain the assets and something can be picked up and carried on. And risk can always be de-risked, and maximizing talent in the team, being good at fundraising, being market-led, with the right technology is needed to succeed. So that's the challenge. And so what is the biggest challenge that the startup faces? Well, obviously, it's finding the funding. And this is a particularly unhelpful diagram, which is why I use it. It's from grants to equity, from seed funding to Series A and B, then on to working capital as debt. It's a chaotic maze and a full-time job to find your way through. And whether it needs an interim fundraising director, activist, investor, intermediary help, NED support, corporate venturing, there's room for a one-day event on this topic, and this isn't it. So let's try and simplify this. So there's no red star on this for obvious reasons. So, all right, finding the funding. This is a maze, but obviously the first two are obvious. Grant funding is important, and certainly important today. Seed funds and crowdfunding are rarely an issue. But firstly, real limited partnership venture capitalists managing their own agglomerated fund are almost extinct. There is no mechanism of starting such funds at the moment. Many VCs are effectively fronts for angel networks and family funds, and funds based on high net worth technology exits are also out there. And activist investors who come with more than money and connections are worth looking for, but are rare. But corporate venturing and virtual corporate venturing, the companies investing can fill the gaps, but needs chasing and isn't normally formalized. So international funds in the UK know now that UK's R&D's value for money, and they're usually US funds, and they're worth looking at. And Meditech is difficult to fund in the UK for reasons which we can discuss at the end. So, some tips. Avoid zombie funds, which are ones which are not actually investing, but looking as if they do. Always approach an individual in a fund, and only, or an angel, and only a few funds at a time, and no scattergun, because you learn every time, and your approach gets better every time. There is a useful curve to look at, and this is the startup financing cycle. This gives us a picture of a trajectory from companies up to secure survival and connects progress with investment in a good way. I'm immensely grateful for the label of Valley of Death. That's really good. That's something that is part of almost the whole territory we're covering. Fortunately, it can be made much shallower and less fatal by de-risking. And that's later in my slides here. A startup can reach viability by one or more investment rounds or one big investment US style. There is a danger in both, of course. And there's a problem also that when you actually get a little bit further up the line, up here, there is a lack of step-up funding, and so that can only really be filled with corporate venturing funding. Now, I said that the VC sector is patchy. Let's have a look at the Angel Networks list. This is my own list, which is current, and you're really going to need to load this one down. It's actually just a list rather than links. These are all technology angel investors in the first row. Some sector focus, others more general. These are not funds as such, but kind of angel networks or hosts of angels, if you prefer. Even though some may work with others, maybe cherubs, angels, or archangels, you generally must find an individual angel to win them over. And some funds are intermediaries operating between the investment and a group of individual angels. They add access rather than value. I have divided up between technology and broader range investments, but all are relevant and current. So this is just a list, not links. But just a comment on investment forums. These are a brilliant idea. Funding Index has recently disappeared, although there's an element of that sort of forum in Set Squared. An investment forum means that funds and corporate venturers can see would-be investees and vice versa. This enables the process of making companies investable by increments and finding an investor by showing the investee and allowing the investee to adapt to the investor. Remember, the money has to work, and this can be helped by interims or NEDs, and forums allow investees to evolve. Either way, important slide to capture it. Now, whatever economists tell you, risks can be reduced. Here are the reasons from CVI Insights of why startups fail. Failure to raise funding is top. Arriving at the market early with the wrong product is next. Just knowing this list makes minimizing these outcomes perfectly possible. In doing this, it is essential to ensure that the aim must be to make the investment work and not deny reality and stick to an original unimproved plan. And the list is usually cited as inevitable. Boy, is it not. Here are the de-risking solutions. Note that stop-start of projects can save value created and keep value on the balance sheet. Data sheet engineering is cited here. This is a worksheet tool which I will be giving you later on the next slide, which makes the market secure and the money work. And this follows this particular slide. Note the reshaping the startup in a number of ways is at the heart of de-risking, and NED help combined with new company connections and M&A possibilities are the main rescue ingredients. I rushed through this one, but there's a lot on this sheet which is worth looking at. And now finally in this list, datasheet engineering. This is a worksheet tool which comes out of the CoVentures de-risking kit. If implemented, it can make the startup coherent, make the intended product service easy to understand, create fundraising material, validate the intended market, improve the product via feedback, and make invaluable introductions. It may even displace the business plan in some situations. Of course, it's a worksheet, so it actually demands something of the organization, and therefore the work is to be done around the worksheet. Itself, it doesn't solve the problem, but it actually points out what the difficulties are and allows them to be removed. So this is the thing you need to load down. It's its current version, it's perfectly usable, and it is very helpful. And when you are copying this, the bottom line is the use of startups can be a credible career option, and there are many reasons that companies should keep an eye on startups or even consider them instead of in-house R&D. And startups do create growth. And this is also my cue to reintroduce Jeremy and stop sharing.
Thank you very much, Mark. I will share my slides, which is here. And can everybody see that? I'm assuming everybody can see that. So, there, I'll press this button here. Right, screen sharing. So thank you, Mark, for setting the scene. I'm assuming that if Mark, give me a thumbs up if you can see that. Right, brilliant. Okay. And so to introduce myself again, for anyone who missed the beginning of the webinar, I'm Jeremy Holland. I'm Chief Executive of Cranio. We produce technology that enables the quick, simple, cost-effective, and importantly, non-invasive measurement of intracranial pressure, which is a key physiological vital sign indicating the severity of traumatic brain injury. And I'll unpack that mouthful over the next few slides. I also want to describe a little bit about the journey that Cranio's been on, where we're going, and a bit about what that journey's felt like. So before I start, I wanted to explain why Cranio's here. We were chosen as a case study because we were honoured to receive an award from the Institute of Physics last year, the Lee Lucas Award, celebrating the innovative use of physics in an early stage medical technology company. I got some pictures here of the team at an award ceremony that we attended at the House of Lords in November last year. And so here are the trophies that were handed out on the day. There's our Lee Lucas Award at the end there. They're very, very heavy. And as you can see here, it takes two of us to hold one. And then there's a picture here of our generous host, Lord Willets, looking at the technology that's being modelled by our head of data science, Dr. Shadi Haj. We were very pleased to receive this award, which came with an amount of money, which was very welcome, as it's given us a platform to increase our reach and the volume of our message. So let me say a little bit more about Cranio, specifically what problem we're solving and and what we're looking at. The condition we're focused on is traumatic brain injury, which is a medical term for what happens when you receive a severe blow to your head. And traumatic brain injury is a big problem. It's estimated that over 70 million people around the world suffer a significant traumatic brain injury each year, maybe significant enough to attend accident emergency or its equivalent. 36 million of these are sufficiently severe to require being hospitalized, and 20 million will die. In fact, it's the biggest killer of adult males under 40 globally. The number 20 million is equivalent to 3 COVID epidemics each year. And those people who survive are likely to have lifelong and life-limiting disabilities, as even minor damage to the brain can result in impaired cognition, reducing the ability to concentrate and reducing the ability to control emotions, leading to brain injury survivors losing their jobs or leading to family breakup. Traumatic brain injury has a very high social burden. So what's the relationship between traumatic brain injury and intracranial pressure, or ICP as it's known? Well, when you hit your head, if it's a sufficiently severe blow, it can cause the brain to hit the inside of the skull and become bruised. This in turn causes inflammation of the brain, and as the skull has a fixed volume, this increases the pressure in the skull, which is the intracranial pressure. The intracranial pressure, or ICP as it's known, is an indicator of brain injury, but it's also a problem in itself as it's a cause of secondary brain injury, which is injury caused by having too much pressure exerted on the brain. This is where excess pressure in the skull further damages the sensitive tissues in the brain, causing further swelling and bleeding. So the knowledge of intracranial pressure is important to direct the correct treatment of brain injury, and it's especially true when the patient's neurological status cannot be assessed through observation, such as when the patient is unconscious or is cognitively impaired because they're intoxicated or because they have dementia. However, currently the only practical way of directly measuring intracranial pressure is to drill a hole in the patient's skull and inserting a pressure sensor into the brain, which is, as you can imagine, a highly invasive procedure. In fact, it's considered the most invasive diagnostic procedure. Here's a picture of a child with the invasive bolt fitted. But clearly there are many drawbacks with this procedure. It's complex, or at least it's complex enough that only a trained neurosurgeon can perform it. It can lead to complications, infections, and even death. It's expensive. It requires a neurosurgeon and operating theatre. The NHS tariff for the procedure is £9,050 a patient. And that's not including the cost of intubation and intensive care, patients staying on intensive care. As a comparison, we're targeting a price point of about £100 a patient with our technology. It's outside the golden hour, which is the initial time after an injury where the intervention, any clinical intervention, will be most effective. And there are many times that clinicians would want to know what the intracranial pressure is, but don't, because accessing it is so slow, expensive, cumbersome, and risky. And because of that, less accurate indirect measurements are used instead. Is there an easier way of getting intracranial pressure? We believe that there is. And this is our solution, Cranio's non-invasive intracranial pressure measurement technology. We use technology developed by researchers at City University or City St George's University of London. The underlying approach is called photoplethysmography, or PPG, and is the approach used to measure blood oxygen with pulse oximeter finger clips. The PPG that's incorporated in finger clips uses red and green light, and we use infrared light, but many of the principles are the same. A small lightweight probe, a sticker really, here's one, that sticks on your forehead, is attached to the forehead. It contains a number of infrared light emitting diodes and photodetectors. At the wavelength used, the scalp and the skull are partially translucent, and so some of the light, which is shone by the LED, is reflected from the surface of the brain. We're able to isolate this and use it to see the pulse pressure waves in the arteries of the brain. As the pressure increases, the arteries are squeezed, the shape of that pressure wave changes, and we're able to extract that, use features associated with that, and machine learning to extract intracranial pressure. It can be done as a single measurement or to indicate trends over time. So the figure we have here is taken from our patent and shows how the light is reflected from the surface of the brain into our sensor. This is a model, a non-brain injured model, modeling the probe. And here's a close-up of the working side of the probe, showing a bank of light-emitting diodes, or near-infrared light-emitting diodes, and 2 photodetectors to pick up the signal. The technology came out of the Biomedical Engineering Research Centre at St George's University of London, which was run by Professor Panicos Kyriakou. I have a video here which I hope to share of Panicos saying a little bit more about the invention.
I loved innovating, creating solutions. Engineers, they're people, they just love problems. My name is Panicos Kyriakou. I am a professor in biomedical engineering. I'm also the director of the Biomedical Engineering Research Centre at City University of London. And every wearable device that you see on the market, if you flip it, you will see a light underneath. A green light, maybe a red light. That is using the technique of photoplethysmography, PPG as is known, where this lab is internationally renowned. For us, the utilization of light in sensor technologies enable us to interrogate the body. Whether we're interrogating the skin, the blood, that fusion of knowledge of software, hardware, and sensor technologies can create amazing solutions in healthcare. We have been visited by neurosurgeons. They said, do you think we can monitor intracranial pressure in traumatic brain injury patients non-invasively? You get a patient after a big accident, the pressure in the brain is rising. And if it's rising, it will create bleeding in the brain or a hematoma. They put a drill, a hole in the scalp, and then they inserted into the brain a sensor. And it is the most invasive, non-therapeutic procedure. Harnessing the knowledge of light that we have, we developed the first non-invasive optical sensor. We place it on the forehead, we shine light into the brain, and we do know from studies we've done in our lab that certain colors or certain wavelengths of light can penetrate into the brain. But some light comes back. It was amazing. The most beautiful signals coming back from the brain, and then we apply machine learning models in order to tell us how that light is affected by hemodynamic changes in the brain. And people said it cannot be done. We won the Britain STEM Award a couple of years ago, which is a very prestigious award. And very recently, the university has licensed this technology to a consortium from the Netherlands, where a company will be built, UK-based company, to take this forward to commercialization.
Thank you, Panicos. Back to. So what Panicos was talking about was the establishment of a company based in the UK, that is Cranio. And here's Cranio's team. As you might expect, being a university spin out, it started with a strong academic flavour, but it is now moving in a more commercial direction. I'd like to say a little bit about how Cranio was created. We're an NLC company. So NLC is a Dutch venture capital company based in Amsterdam. Their model is to scout around the world looking for promising intellectual property that they can spin into a company. NLC identified this technology that will form Cranio in early 2022, and the company was set up at the end of the year with the intellectual property license into it. NLC then appointed a commercial chief executive, which is me, and I've led the assembly of the team and the creation of the company. In our case, we were lucky as the academics behind the technology were keen to continue to be closely involved, specifically Professor Kyriakou, who is the initial inventor and has joined as our chief scientific officer, and Dr. Maria Roldan as chief technical officer. Maria's PhD consisted of work conducting at City St George's University at the Biomedical Engineering Research Centre there, looking into the early versions of the technology. Shadi Hadj, who is our head of data science, was another PhD student from the lab. And we're now expanding the non-academic side as we move towards completing the science and engineering and getting a product to the market. We're currently pre-revenue, but we aim to get a fully accredited product to the market in 2027, by 2027. So as I said, so we'll get to the market by 2027. And to do that, we need to gain CE mark accreditation, as we are a medical device, which will enable us to sell to EU and UK healthcare systems. We'll then look at getting FDA accreditation, which will open up the US market. So this is a diagram of our view of the market, or the market for Cranio. Our initial target it will be in the hospital, monitoring of patients and preventing unnecessary escalation of care, which is currently a large expense. We then want to expand towards accident and emergency and then paramedics. Our aim is to get knowledge of intracranial pressure out of the intensive care unit and closer to the scene of an accident. We're essentially trying to democratize intracranial pressure, which is currently really only accessible by an elite, the neurosurgeons, not to say in their ivory tower, but certainly in their intensive care units. By enabling a greater knowledge of intracranial pressure earlier in the care pathway, earlier interventions can be applied, but also if the patient is shown to have a healthy intracranial pressure, we can prevent the patient going down expensive, unnecessary diagnostic pathways. We will be the device manufacturer from a CE marking point of view, but obviously we're not going to do the actual manufacturing. We're working with a contract manufacturer called OC Electronics. So the accreditation has us as registered as the technical manufacturer. We're starting in the UK, as this is a stipulation of our grant funding, but we would look to move to the EU and US within 18 months of launching the product. We'll be looking for FDA clearance in 2028. And I'll talk a little bit more about some of these markets. So what do our market sizes look like? So we're initially concentrating on two sectors, which is the large acute hospital that sees many hundreds of head trauma patients each year, and first responders, paramedics, ambulances, air ambulances, who attend the scene of an accident. The model we're looking at is a disposable probe, which will sell at about £75 a time. So that's this one I held up earlier. And a reusable base unit, which will actually give the readout with the intracranial pressure. And that will be rented at a cost of around £3,000 a year. This gives an effective price to the purchasing body of at about £100 a patient. We'll be selling directly ourselves in the early stages to hospitals and to ambulance trusts and their equivalent overseas. We'll start in the UK, which is our home market. We need to establish early sales here. As I said, this is a stipulation of our grant funding. We're going for CE mark accreditation, not UCAS, which means that we'll be able to sell in the UK and the whole of the EU. The EU market will be open to us. We'll be making initial sales here, possibly the Benelux countries, where we have good connections with our backer NLC being based in the Netherlands. 2028 is when we'll be gaining FDA approval, and we'll start selling into the US at that point. So if we take those two markets only, limiting ourselves to patients that have been admitted to hospital with brain injury or attended by paramedics, we see that the total addressable market is, we've calculated as being 675 million, which is about $900 million. So if you add other developed countries outside of these regions, it pretty quickly takes the number to well over $1 billion. But that's our initial market. It's not our only market. There are many other markets that we plan to go after. The military is an obvious top market. Head and neck injuries, including severe traumatic brain injury, were reported in 25% of American service members evacuated from Iraq and Afghanistan and the conflicts there. And it's considered that, it's estimated that up to 40% of military mortality is attributed to traumatic brain injury. So it's a significant problem in the military from direct injuries and blast injuries. Often access to technology that's taken for granted in hospitals, such as CT scanners, is unavailable in both the first and second line military hospital facilities. In these situations, life and death decisions are being taken with often very little information about the patient's neurological state, somewhere where Cranio will be able to help. Maybe less significantly, but still important, is the cost of treatment and treatment escalation. A military evacuation to a conventional hospital is extremely expensive and may be logistically challenging. Cranio can provide information that both improves outcomes and, by preventing unnecessary escalation, reduces costs and danger. We're in discussion with the UK and other militaries to explore this opportunity. It's clear to us that there are a number of requirements that we've encountered that are very specific to the military that might not be immediately obvious, but that's a direction we're going in. Low and middle income countries, LOMICs, are another exciting opportunity. The vast majority of traumatic brain injury happens in LOMICs, primarily from road traffic accidents. LOMICs see 90% of global road traffic accidents. The mortality rate from traumatic brain injury is higher in LOMICs, and the disability in survivors is greater. The mortality rate for traumatic brain injuries in the developed world is 3%. In the developing world, it's 30%. So we see a great opportunity to provide cost-effective diagnostic technology to this market as part of an overall push to improve access to improved neurological care and improved outcomes there. We know a disposable probe would be cost prohibitive in this situation, and we're considering a future version of the technology that would use a reusable probe, which would further reduce costs. We're in discussion with representatives of the Malaysian healthcare system as an early LOMIC market. Primary care is another possible market. Around 10% of a GP's caseload is headache. It's almost always benign, but it isn't always benign. And sometimes it's indicative of something more serious like a tumor. And because of that, it leads to many unnecessary referrals to MRI or CT scans and accident and emergency to hospitals. A simple, cost-effective tool to screen out benign headache would reduce costs significantly. It may be possible for this sort of screening to take place in pharmacies, preventing the patient ever even needing to see a GP. The numbers here are large, but again, we'd be looking at a reusable version of the technology. And then sports injuries are a potential market. There's a lot of interest in a device that can objectively and quantitatively indicate whether a player is concussed after a collision. So whether they're safe to continue playing or need to be taken off the pitch. Well, concussion is not the same as traumatic brain injury, and we don't know if it's accompanied by a rise in intracranial pressure. We believe that the PPG, the photoplethysmographic signals that are picked up by Cranio's technology, can show whether someone's concussed. And we're exploring routes to acquire the clinical evidence that will demonstrate this. Finally, then, there are other clinical indications where raised intracranial pressure is an important vital sign, such as stroke, hydrocephalus, and a number of other acute and chronic conditions. There are also situations where access to hospital levels of diagnosis and treatment are unavailable or expensive. So there are many potential markets for the technology, and we estimate the overall total addressable market as being several billion. I think it's important for us to be alive to these other opportunities, but not get distracted. Our focus is on proving the technology, which is our initial market, which is what we're focused on now. Just to summarize how we got to where we are with a timeline. So back in 2016, that's when the initial academic hypothesis was formed and was investigated and refined. And the key to this collaboration was our current chief medical officer and the head of neurotrauma at the Royal London Hospital, Professor Chris Uff, working with Professor Kyriakou. And it's this relationship really that's propelled the project forwards. Following initial lab studies, a clinical study was conducted in 2020 over the pandemic, which demonstrated good levels of accuracy. So this was a study where in the intensive care unit, where patients who had the invasive bulb fitted had our technology fitted at the same time, so we could train a get data to train a machine learning model and then demonstrate the accuracy. Following this successful clinical study, as we said, it was decided that technology should be commercialized in 2022, and Crania was set up to spin out, backed by NLC, our Dutch VC backer. The IP intellectual property has been protected with a patent that was lodged in 2019, and that was granted in the US. It's lodged in Europe and the US. The patent was granted in the US this year. And of course, patents been significantly built on with proprietary know-how and data since there. On the finance side, we started with pre-seed funding from NLC. This was followed by early grant successes that enabled us to redesign the hardware, probe and control unit, and to develop relationships with key trusts. The Royal London Hospital, St George's University Hospital, part of City St George's University, and Cambridge University Hospitals, and conduct the clinical studies that are needed to generate the evidence which is needed to support the accreditation of what's a highly regulated device, or will be a highly regulated device. We raised 1.3 million in grant funding in total, and 200,000 as an early seed investment from angels last June. This is where we are now. So we raised 100,000 in a new grant at the beginning of this year, and have just closed at the beginning of August an additional 330,000 as a seed investment. The money is supplementing grants that we have to fund what we're calling our feasibility study. This is to gather data and enhance our machine learning model to demonstrate we've got a baseline level of accuracy. We are now getting to standard of care levels of accuracy, which this study will enable us to do, and it will enable us to complete the design, the hardware, leading to what's called a design freeze. We'll then be looking to raise, so that's where we are. We'll then be looking to raise 2.5 million in mid-2026, which will supplement our grant income to complete the clinical validation study and get the product through its regulatory pathway for a Class 2B medical device, which is a classification of the device that we have. We'll start sales in the UK once we have CE mark approval, and then in the US, and then the EU, and then the US, which will require FDA approval. We're looking to raise an additional 5 million in Series B funds to support that activity, and that will take us through to potential exit of around 2030 when we've demonstrated commercial traction. So starting to explore commercial partnerships with a number of strategic corporates to this end. So I wanted to spend a bit more time just drilling into the funding story, because I think that's important, as Mark said, is vital to get to get money to keep you going and to drive you forward. So at each stage that we've raised money for a particular, we've tried to raise money for a particular purpose, and when we've achieved that purpose, it justifies going for the next sum of money. So the evidence of progress can be what's called a value inflection point that shows that the company is more valuable, is less risky, and can justify a new round of investment. So we started in mists of time in 2016 with academic grant funding. And there was a number of grants that were given, but there was the major one was from the NIHR, and this money paid for the initial clinical study at the Royal London Hospital, which demonstrated the feasibility of the approach and established a baseline level of accuracy. This led to Cranio being set up with the initial pre-seed investment in the form of a convertible loan from our backer NLC and some money from the management team. This enabled us to establish a company and submit bids for a number of grants. We paid a professional grant writer to help us with these, which was money well spent, as we've won over the course of a few years 4 grants totaling £1.3 million. And here's the different grants that we've got. Grants aren't sufficient. They tend to pay in arrears. And in the case of Innovate UK, they don't pay 100% of the amount that you're spending to run the project. There are also a number of items necessary for the running of a company that aren't covered by grants, and they don't pay for things like pay rises. So there's all sorts of things that aren't covered by grants. The winning of these grants, however, was a value inflection point. So Cranio had been significantly de-risked. The science and the company strategy was validated through the diligence associated with the award of the grants, and that enabled us to go out to private investors, to angels, and raise money. So we did this using a technique called SAFE, which is a simple agreement for future equity, which was a relatively quick and easy way of getting money into the company in mid-2024. And this has been followed by a further fundraising activity that's seen us close an additional 330,000 in August this year. So this is supplementing the grant funding, as I say. It's specifically what we're looking at, supplementing the grant funding that's run in the clinical study, which is looking to improve the accuracy of the device. The inflection point here, which we haven't got to yet, but will come from positive results from this study. And this will justify us returning to the market for a larger Series A raise in mid-2026. That's what we're looking at now, and this will take us to getting accreditation, meaning that we're able to sell to as a medical device. So that's CE mark in Class 2B. And we believe early sales will lead to a further inflection point and proof of the commercial viability of the product. And that's when we'll be going back to the market to raise a further £5 million once we're on the market to accelerate our growth. Just to finish off then, as this is always the ask in any small company talking about where they are. It's always we've closed a recent seed round, 500. Well, total it adds up to 530k in August. But as soon as that round closed, as soon as we bank the money, then we need to start looking for the next chunk. So this is a Series A I spoke about. The Series A will take us through the process of getting the product onto the market, completion of product safety, usability, and most importantly, clinical validation tests. Does it work in the way that we say it does? The funding will enable us to work with regulatory authorities to get the product approved for the use as a medical device. In the case of medical devices, the authority is delegated to an organisation or to organisations called notified bodies, and we'll need to work with them, and that can be quite an involved procedure. So the funding we're looking for to raise this will fund the Series A we're looking for now will fund a year of sales activity, which will demonstrate commercial traction. So at that point, we'll be then looking for a raise Series B. In time, we'll be looking for an exit to return money to investors through a sale to a strategic company around 2030, when we've shown traction in Europe and the US. So that's sort of some summary of Cranio, and I just wanted to have a couple of sort of reflection slides at the end. I was asked to say a little bit about me and my journey and how I ended up at Cranio. So I've always focused on early stage and innovative technology. I was a scientist at university. I think it was even before university here. I studied in physics. I conducted a PhD in medical informatics. That was a joint, as an industrial studentship, it was called. So it was joint between City University, where I'm an alumni. So I'm an alumni of City University. I did my PhD, and St Thomas's Hospital as a combined research project, combined research post. I worked for a technical consultant and joined the dot-com boom in 1999, and I co-founded a company called Kinetic, which specialised in online recruitment. Excuse me, back in '99. at a time when that was a new thing. And I think we were quite successful. We ended with 20 staff and 70 clients, of which the biggest was the NHS, with a product called Oriel that's still in use to support the recruitment of all junior doctors in the UK. It was a great experience, and it's where I think I caught the startup, early stage, small company bug. We exited the company in 2016 in what was effectively an M&A deal. I then worked in various companies, ending up at Science as head of science and technology at a medical device company called Zim or Lifelight, which is a company that uses PPG, photoplethysmography, to measure blood pressure remotely. So that's using selfie cameras to look at every time your heart beats, your face blushes slightly, and it uses that signal to deduce heart rate, breathing through sinus arrhythmia, and blood pressure, again, through changes in pulse morphology. But that introduced me to medical device companies. I was there for 4 years, and I found that absolutely fascinating. I left in 2021, was headhunted by NLC to head up Cranio, which is it's a fledgling medical device company out of City St George's University. I'll just finish up then with a few words about working in a startup and why I think it is a good and exciting career path. It's where I've been for the last 25 years, and I found it very rewarding. Here are a few of the companies where I've acted in a leadership role over that time. They're all startups when I joined. Some have exited well or less well in occasion. Some have survived, some have thrived. I think the key thing is that in a small company, you're always closer to the decision making and more likely to be able to have a hand on the tiller, maybe not the only hand, but another guiding hand. Decisions can be made fast made quickly without needing going through layers of bureaucracy. And so this leads to feeling like you've got a greater ownership of the product. It's your product, and seeing your product in use is a brilliant and very rewarding feeling. The atmosphere tends to be high energy. It can be potentially lucrative. If the company is a success and grows, you can grow with it, and especially if you have equity in the company. However, you need to go into this world with your eyes open. It is high risk. There are many ways in which a small company can fail. An early stage company, there'll be little fat to rely on when things get tough. It's a cliche to say there's nowhere to hide, but a 4 or 5 man company can't support passengers. And it's really not a place where you can cruise. It can be high pressure with long hours, and there are no support teams. So if something needs to be done by you. And that will probably include doing things that might be outside your comfort zone. And there will also be lots of things that you as a company would like to do and like to hire experts to do it, but you can't because you haven't got the money, so you need to do it yourself. And if you're not an expert, you need to muddle through and gain expertise pretty quickly. But what I can say is that life in a startup is rarely boring, for good or ill. And as a Chinese proverb has it, joining a startup means you will definitely live in exciting times. So that's the end of my presentation. I will hand back to Mark.
Thank you. Gosh, I think that's a very huge opportunity that you're facing. I mean, what do you see as the biggest challenge ahead of you now? Is it the funding?
Well, I think in a way, yes, but there are many challenges that are interlinked. So yes, we need to raise money. We need to show evidence that we've got a market. So we need to develop our market. We need to hire the right people. I think my focus at the moment, though, is doing all of that and balancing the plates. But we just closed a round. So what you also need to do is focus on execution. And we're running a clinical study, and that needs to be conducted successfully. And that's quite a complex undertaking. Good early results from the study will accelerate our value and lead to that inflection point I was talking about, and I think make us a much more interesting prospect for investors. So this is what we as a team are concentrating on now. Everything else is going on too. There's lots of plates that need to be kept spinning, and I've been at an investor conference on last couple of days this week. So yes, it all happens in parallel.
Well, I'm intrigued about the fact that funding obviously is necessary to arrive in certain sums at certain times, because the tasks and the markets are pretty clear. But the source of funds, is that likely to be venture capital, development capital, or really is it likely to be corporate investment, do you think?
I think we are talking, I mean, it's early days yet, but we are talking to classic venture capital companies. And I think, as you said, there are venture capital companies that look like venture capital companies. When you dig a bit deeper, actually, there's a corporate standing behind them. And as long as your interest aligns with the interest, or your activity aligns with the interest of that corporate, then there might be a fit. But I think no, I'm also looking at sort of the next level up in angels. So there are angel networks. There's medically focused angel networks in the States. There's regulatory issues around that, but we want to move to the States anyway, and in time we'll be raising money there. So we might need to just bite off the take that bull by the horn. So there's a number of different routes. I'm not, I think we just need to keep our options open and go and do. I mean, it is time consuming and there's a lot of work that needs to be done, but we can't go down one particular avenue just in case that doesn't yield results.
I think the stepping stones approach is the only way that you can actually see the future from where you are. But I think that the possibilities of creative partnerships are all around you, and as you move forward,
Yes.
on what is the only navigation you can do, there are going to be opportunities which are likely to draw you aside. And I assume also that the photoplethysmography, I've got it right this time, it has got other benefits and other, as you've already illustrated. So there are going to be other products. Are you on the horizon? Are you thinking of things of that sort?
Yes, no, definitely we are. I mean, I think that as I said, there's a huge market for even cheaper versions of the technology, so reusable probes rather than disposable probes. But of course, that will reduce the size per sale, but it means the volume is much bigger. And I think also I'm particularly interested in the military. Obviously, there's a lot more interest. There's a lot more money going into the military at the moment, into defence spending, and dual use technology is something that's quite hot at the moment. So that's a direction I'm particularly looking at. But yeah, no, our future versions of product, future clinical indications, future use scenarios, they all add. Yeah, they all add to the story, but equally you need to make sure you don't get distracted.
And of course, we have to fight the valuation battle.
Well, yes,
as we all do. Can we ask Jed into the circle? It would be. I gather there were some questions which.
Yes.
You suggest.
Yes, indeed. Yeah, firstly, thank you, Mark and Jeremy, for a really insightful view here. Certainly, we've had a couple of questions coming on the Q&A, and I selfishly have one as well before I have to drop in a moment. But I'll just summarise. So Pierre has asked, has there been any suggestions of using technology for the veterinarian sector? So say horses that might have had a cranial injury. Matthew's asked. Also, why going for MHRA clearance? Understanding that FDA or EU MDA clearance has been approved for crossover to MHRA clearance. So one there around some of the challenges. And I think just on that point, I guess built to Pierre's question, my own, which was things like the growing sector around sort of healthcare, sort of self-health healthcare, or gym users. We're all monitoring our own biometrics, a lower risk category in terms of regulation, but one, if you enter with your eyes open, can give you data and metrics about your performance, your fitness, and your health. So perhaps some other avenues to explore, but I don't know, Jeremy, if you had any thoughts on some of those. Thank you.
Yeah. So I mean, veterinary. I mean, that's definitely. I mean, what we've validated the technology in an intensive care unit on people who've been in road traffic accidents. The technology is applied to the forehead. It needs to be on skin. But the underlying physiology, the physiological principles are going to be similar. I guess it depends on the size of the market. We know the size of the market. Is it similar size? Do people care as much about horses as they do about people? Certainly, very expensive horses, definitely. But there's definitely there's no scientific reason why we couldn't do that, and that's something to add to our list of possible markets. going on to the MHRA question. So we need MHRA approval to run a clinical study in this country. We then need accreditation to be able to sell in different markets once we've proven that so accreditation to prove that we're a valid medical device. So the accreditation that we're looking for in the first instance is not from MHRA, it will be a CE marking. So CE marking is, as I think the person who asked the question implied, covers both UK and the EU. The UK equivalent, UKSA, only covers the UK. So we're going for CE marking, which is really a similar level of complexity as UKSA anyway. And then once we've got that, we need to start with a UK market because of our grant funding. NIH make that quite clear. They need to get some benefit for the money that they're not investing, that they're giving you. There needs to be some comeback to the UK. But once we've done that, we're then moving to the US, which will require FDA approval. So that's our strategy there. And then finally, on the wellness side, absolutely, I think that's a market there, and I think that there is a danger that wellness you don't have as much evidence, which means that the market can be a lot more crowded. Having said that, just not giving people the intracranial pressure, but just showing them their pulse wave for people who are elite athletes or who are on the cutting edge of biohacking, absolutely there's a market there. Again, how big a market is, I don't know. And I think there's mass market wellness products tend to suffer because you can't get the premiums in product sale, in the valuation. But yeah, there's certainly it is another market there.
Fantastic, and I think so. I realise we're probably at time now. I think with no other questions coming in, if everyone's happy, we'll probably close out very shortly. I think there's one thing that just occurred to me though, in your final comments, you talked around in a startup there's nowhere to hide, and you find yourself having to do all these extra jobs that perhaps you didn't sign up for when you first joined. And I think that's a really, really important piece because it pushes you out of your comfort zone, but that's where the greatest learning is. On that though, I think with the work that we do in the big group at the IOP, the IET, advisory groups, networks, how valuable do you see it to be able to just reach out to a friendly face, some free advice, network support? How valuable has that been to you?
I mean, I think you should take advantage of as many networking opportunities as you can. We've been very lucky. We've got the IOP, NLC, which is our a VC backer. They bring their own network of organisations. So the other portfolios that they've invested very extensively. So there's over 100 companies around Europe that in various stages of development that they've invested in. We're also lucky enough to be part of an organisation called LIHE, the London Institute of Healthcare Engineering. They run an accelerator that we've been part of, and obviously the connections we've made through the Institute of Physics. So I think absolutely take advantage of as many of this as possible, because there's, I said, you have to muddle through, but you also have to be an expert in things that you've got absolutely no understanding of at all. Now, what do I know about reimbursement strategies in the US? Absolutely nothing, but it's pretty important as we're looking to get into the American market. So that's where I can pay huge amounts of money for reimbursement consultants, or I can just ask lots of people who've already done it, which is a little bit cheaper. But yeah, so taking advantage of those contacts is absolutely invaluable.
Fantastic. Mark, Jeremy, thank you very much. Thank you very much to our IOP host. Thank you very much for everyone participating online as well and listening and your questions and participation in the chat. That's great. Thank you. Have a great afternoon.
I think I'll put up the closing slide shortly, but I just have two comments. One is that we can out-science but not out-market America, and I'm aware of a company that went bust that cost 15 million and did not achieve it in America. And the second thing is that if you actually keep your hand on the supply chain for the product, you could take this straight, or not straight, but you could end up on NASDAQ as the company. It's also a possibility. Just keeping that supply chain in your hand would do that. And on that note, So we leave with our email exposed, and any questions that remain, fire at us. And if all of my efforts to download things didn't work, contact me.
Thank you very much. Thank you, everybody. Right.